realize that the non-contrast CT is what is going to help you to know which direction. Because if there's hemorrhage, you have to use a different treatment plan. If there's no hemorrhage, you have to use a different treatment. And this determines whether thrombolytics is given. So, because if you don't do the head, the non-contrast CT, if you go on to give it in a patient who is already bleeding, you're in trouble. Now, why don't we do an MRI? A patient who has an acute stroke as a first line. There's a place for MRI, and how we go to the class, I'm going to talk about it. MRI is more sensitive. It takes longer, okay? And it's not the first line in acute setting. Remember very well that in the MCQ1, one of the things you need to focus on is first line next best steps. So remember that non-contrast head CT scan is the first line, right? Non-contrast head CT is the first line. However, there's an indication for MRI, and I'll come to that. Why is CBC not the first line? CBC in coagulation can be helpful, but it's not the top priority. ECG helps us to determine the etiology, especially if it's a thrombotic stroke, right? If the patient has an atrial fibrillation, we can pick it up on the ECG. And carotid Doppler is for secondary stroke prevention, not in the acute setting. So in the acute setting, so far as the patient is, stable, get your CT scan as quickly as possible. Get your CT scan. Okay.